Good morning, Michelle.
Good morning, Victor. How are you?
Good. How are you?
I'm very well, thank you.
Great.
All right, Sue McCary, you are the first one to put your name in the chat before I even mention it. Thank you very much. I've just sent a message to Karen Vleck to remind her to get on as well so that she can take our role for us and get the data timely uploaded into Epic, or not Epic, Echo, sorry. Hi there, is that Mandy Downs? Is that you or someone? That is you. Great, good to see you. Beautiful wallpaper in the back there.
Yes, thank you.
Excellent. And a reminder as everybody's logging on to please put the name of your facility and each individual, if there's more than one of you, on the actual link that you have so that we can be sure and record every individual who's been part of our session. So please take a moment in the chat box. That is the only way right now we can be certain we capture everyone because the link only gives us the name of the individual's email that signed on. If you forget, please send an email to Karen Vleck and myself, or at least one of us. So that is the only way that we have an accurate listing of everybody on the call today. And one last reminder, please take a moment to put in the chat box the name of your facility and each individual who signed on with your link. We have an email account. Every email that signs in, we have record of, but if there are more than one of you sitting there with your masks on, we don't have a record of the others who are not the email account. So we want to be sure and get everybody credit for their time. So please be sure and put your names, all the individuals, into the chat box. And since I don't see that Karen Vleck has signed on yet, I'm going to record this for her so that she can get these data uploaded. Okay. All right, and with that, I'm going to begin by welcoming everybody to session 8. Our main topic for today is COVID recovery of our staff. So I'm going to share my screen to start. And let me put this down and go to my presentation for today. Our session today will be a quick update on COVID-19 vaccinations and long-term care, since data are available on a daily basis. I wanted to share with you our successes. And then we'll go in the chat box. I'd like each individual who can type at the keyboard to put 5 words or less from your interview of a staff member who's recovered from COVID, their experience, 5 words or less. What was the experience like? I did this with one of my staff, and the response was fatigue, but glad to be back. So please, 5 words or less, your interview, or if you yourself are COVID recovering, that experience, so we can get a range of responses. We'll review the medical literature on staff experiences, and then we'll have a discussion of our interviews and our own experiences with COVID-19 recovery. And then in our wrap up, we'll get prepared for next week when we talk about interdisciplinary approach to COVID-19 infection prevention and care. So with this, here's some hot off the press data. And these data actually came to me this morning through the American Medical Directors Association. Our group keeps each other informed. And one of our leaders in COVID management, Dr. Christian Bergman from Virginia, shared these data with us. These are the websites for CVS and Walgreens publicly reporting their vaccination data. And as of this morning, they were showing the data for skilled nursing facilities and assisted living, each of them, the number of actual facilities and the number of doses. These doses include residents as well as staff members, and first doses and second doses, but at least give some sense of the number of facilities that have been activated. And then assisted living as well. And many of our facilities do have an assisted living component as well as skilled nursing. And we can see that vaccine is being distributed, not as fast as we all wanted, but to me, it's very reassuring to see these data. And these are actual websites for publicly reporting data, not just long-term care, but in general. So I thought I'd share these with the group, and these will be available on our IHI data in our website for education that we share. These are the actual data that I wanted to share with you. I know it's small numbers, but we're a Pennsylvania group today, and Philadelphia data are being pulled out because Philadelphia and some of the larger cities do have a distribution plan for vaccine that is different from the more rural areas. And as a result, there's both Pennsylvania and Philadelphia. But you see both these are skilled nursing facilities here and then assisted living facilities here. And then the data as of yesterday, these are the data from yesterday, active Pennsylvania nursing homes, 510 have been activated with a total of 89,000 doses dispensed. And in Philadelphia, 38 nursing homes in the Philadelphia region with 5,600 doses dispensed. So to me, seeing these data is very reassuring. I know that Genesis is also sharing Genesis data as well, but there is the effect of, there's what I call a grassroots effort to show vaccine and distribution. And I think it's really exciting to see these data. So I wanted to share those with our group today. And that was the CVS, and here's the Walgreens data. So for Walgreens, Pennsylvania, 94, Philadelphia, 8 facilities, but another total 13,000 distributed. And then they also show upcoming for the next 7 days number of programs scheduled, and you can see very active there for the next 7 days for Pennsylvania nursing facilities. So today we're going to talk about COVID-19 infections and our nursing home staff, how they are experiencing it, how we see staffing challenges as a result. And one sobering data element is that 1/3 nursing home staff have experienced COVID, and these are the best data I could find up to November. So it's unfortunately a job hazard, as well as the fact that our nursing home staff are young and in the community and vulnerable for community transmission, as well as work-related transmission. Here's a study from the Journal of the American Medical Directors Association, hot off the press in January, that was a study of frontline nursing home staff and their experiences during the pandemic. These questionnaires went out to 132 nursing homes, and were asked to complete them during the height of our spring COVID infections, May 11th through June 4th. And their responses, there were 7 themes that emerged from about 200 individuals who responded. All sorts of staff responded: nursing assistants, nurses, administrators, medical directors and physicians, nurse practitioners, nutrition support staff. And these were the 7 themes that emerged. And I don't think they surprise any of us. The importance of the constraints initially back in the spring with personal protective equipment certainly should be less of a constraint now as we've had better supplies. But that burnout, theme 5, and the continuing using the PPE. And here we're getting our own questions. I get my second vaccine at 12:30 today, yay. But we're hearing from staff that, okay, now I've been vaccinated, I don't need to wear the PPE anymore. And the answer is no. There is still smaller risk of transmission, but nonetheless, we are not fully protected and those around us are not fully protected. And so vaccination does not change our use of PPE at this time. But I use the phrase "at this time" because as the community spread decreases, we'll see changes in our protocols that are appropriate for the amount of virus in the community. The burdensome regulations and certainly the changes in regulations, and that gets to theme 6 of teamwork and communication and flexibility, and how all of us, no matter what our role in the nursing home is, that we need to know what are the policies, how they've changed, and importantly, why they've changed, because that why often helps us understand the need to change, and being more flexible and understanding. Certainly our concerns for ourselves and then our family with whom we live and interact, concern for those we care for. That's why we're in this business. And then early on, the public blame and lack of recognition of what we do every day. Certainly that's been addressed in the media as well as within our own facilities. But as things roll on, certainly some of the hiccups in vaccine distribution, public blame certainly can add to our burnout, and the importance of, in fact, that communication and flexibility even more so. So I think when looking at this published literature, I don't think it surprises any of us, but it is, I think, reassuring to know that what bothers us, what worries us, is certainly we're not unique, and that leadership and our grassroots efforts through our quality improvement projects are addressing these strong themes of COVID management in our nursing facilities. Staff levels and COVID cases, real literature here in real time, showing that that actually deaths in nursing home, one of the strongest predictors is obviously the amount of COVID in the community, but the number of nursing hours and nursing assistant hours in particular, as well as total nursing hours. So licensed nurses and nursing assistant hours of staffing make a difference in how our residents recover from COVID. So I think it's important to recognize by shoring up our workforce, we in fact provide better care to our residents. This study in the California nursing homes with COVID infection showed RN staffing hours less than 3/4 of an hour per day per long stay resident. This is not short stay, but long stay resident was associated with 2 times higher rates of COVID infection. And again, we know for almost any quality measure in nursing homes, whether it's falls or pressure ulcers or functional improvement, staffing hours makes a difference. And so we need a workforce, and we also agree that it isn't just staffing hours, but well-informed, well-educated, and well-cared for staff make a difference in our outcomes in COVID, as well as almost any quality measure we choose to study in the nursing home. And here are the actual data from this study, and up here the RN hours, a 2-fold increase in COVID related to low nursing hours. And down here, showing some of our other markers of quality. Let's talk a little bit about COVID infection. And actually, I'm going to stop sharing my screen for now. And let's see what's in the chat box right now. Folks have been doing a great job, so I'm going to have to scroll up here because you have been adding all this information while I've been talking. So let's take a moment to look here. Thank you, David Scartino, for getting us started with grateful and humbled. Fatigue, and Jessica Cope is telling us also even some long-term symptoms of sinus pain and pressure. I'm seeing here fatigue being a prominent, almost everybody's talking about fatigue. Someone actually said, wow, Kira, I think maybe we'll ask you if you wouldn't mind, since you've shared in your chat box that you're currently recovering, are you able to unmute and give us more than 5 words on your experience?
Hi. Currently, I was tested positive on Monday, and the only thing I've been having is just like a bunch of sinus pressure. I feel like I have a sinus infection. I'm super tired. I have like no energy on some days. Yesterday, I had a good day where I was up and about, moving, cleaning, and I wasn't tired at all. And today, I'm back to being extremely tired again.
Fatigue, very important symptom, and the length of that symptom. So I want to thank you for joining us today. I'm assuming you're quarantining since your positive rate has been a few days, right?
Yes,
Yeah.
I am quarantining.
Good. But the fact that you've joined us today, I'm going to take a moment and say thank you. Isn't that what we all are called to do when we can? One of my a social worker I work with said, you know, I'm positive, I got to be home, but I know all these patients right now. I know we've got to have throughput, so let me keep working. And then finally, day 3, she said, you know what, folks, I can't work. My concentration isn't what it needs to be, so I am not going to work from home. And we all certainly supported her for a few days. She's back fully, recovered fully. But I have to say, in our COVID recovering patients, she's just so wonderful with them and with their families, having had this experience personally for her. So thank you for sharing that, Kira, and I hope your recovery continues. So good. Okay, so I think in the chat box, what I'm seeing is a good bit of the fatigue, body aches, headache, daily headache. It's even for young adults who are healthy, while we know there's that, we talked earlier about the number that are asymptomatic, and particularly younger asymptomatic, the symptoms can really impact our daily activity and the duration of them. So thanks for sharing those few words. I'm going to go back to sharing my screen and look at the literature on COVID recovery. This is from the Journal of the American Medical Directors Association. The term they use is long haulers. I don't like that term. I prefer the term COVID recovery or COVID recovering. And I think we'll see a new literature emerging here. And the literature shows that to date, about a third of our workforce that has had COVID at 2 to 3 weeks reported they were not their baseline state of health. And that's 2 to 3 weeks after testing positive. And these are just the individuals that were not sick enough to be in the hospital. So they were COVID recovering from home, but a third at 2 to 3 weeks. You know, that's what we would see back when many healthcare workers and workers didn't get flu vaccinations and had influenza. I can recall one story. A nurse practitioner joined our practice in January, had not received flu vaccine from her prior employer, and just hadn't gotten around yet to employee health to get hers here. We, of course, had influenza in our long stay unit at that time. And indeed, she was out for 3 weeks, flat on her back, and was so humbled when she returned by how sick she had been, and said, "I will never miss a flu shot again," and understood. And of course, we also looked at our employee health practices to say, how did this happen? How did we have someone working on our unit who was not vaccinated in a time when vaccine was so important and we knew better? So obviously we had to look at our policies and procedures from a leadership point of view, and the importance of onboarding new staff, and that'll be relevant with our COVID long-term vaccination strategies for new staff, as well as new residents coming to our facilities. But again, that 2 to 3 weeks after testing positive, still not back to baseline health. That's a long time for a young workforce to be ill. There's a study of COVID survivors now, more than 1,500, and just what we saw in the chat box: fatigue, muscle and body aches that continue on beyond just a few days, the shortness of breath, and particularly shortness of breath with activity. So if you're sitting at the computer reading email, that's one thing. If you're up on the unit and you're doing personal care to multiple residents in a nursing home, shortness of breath can really limit your activity when you're COVID recovering. And then that difficulty concentrating, and not just what my social worker experienced of the few days during her acute illness of COVID, but that back to work. And I do recall those first few days she was back, more than 2 weeks later after her positive test and first day of symptoms. She did say, I'm not at my best game. And I'm happy to report it's been over a month now, and she is on her game. But certainly that difficulty concentrating. What comes to mind is Lyme disease, and how with a different type of infection, Lyme is not an mRNA virus, but there certainly are infections where our cognition and our ability to do executive functioning, multitasking in particular, impacted by this type of illness. And then in the literature, something called POTS, which is postural orthostatic tachycardia. I see I misspelled tachycardia. Take that first H out, please. But tachycardia, meaning that when you go from sitting to standing quickly, you get a little woozy, a little dizzy. And we see this a lot in our patient population, particularly those who are recovering from any acute illness. But we're seeing this in our workforce as well. Probably mediated by our adrenal glands, our fight and flight responses, our cortisol responses that just aren't back to baseline after fighting this type of infection. So literature is emerging on why COVID infections in younger adults workforce is not just 14 days of quarantining to prevent the spread, but in fact an illness that requires recovery. Okay, so there's, I think, a literature worth us talking about. So let me stop sharing my screen now. Jessica Copa, you've put down here that you had an employee who had the flu in the fall and then was diagnosed with COVID. Oh, wow. I'm hoping that person's going to be playing that lottery that I hear about that's so multi-millions of dollars tonight. And she's in her early 20s. Jessica, would you mind unmuting and tell us a little more about that experience?
Sure. Yes, she is one of our therapists, and we check in with her daily, and she continues to run low-grade fevers, continues to be very tired on any kind of exertion, still experiencing severe headaches. We had her return to her doctor a couple weeks ago and see if there could be a secondary infection. He did put her on a Z-Pak for a possible sinus infection, but she still has not improved.
Yeah, good. Can I ask you a little more that you're checking in with her? Tell me about that.
Sure. We check in daily. We ask for a full list of her symptoms, for her to tell us exactly what she's experiencing, just so we can monitor, if she is starting to feel better, if she's starting to feel worse, and, we can see when we can clear her to work. She has to be afebrile for 72 hours without any antipyretics and symptom-free to return to work. And unfortunately, she's still requiring Motrin to bring her fever now.
Yeah. I would bet you're just not checking boxes and when she can get back to work, but I bet you're doing some support for her too.
Oh, absolutely. Yeah. I mean, she's this young girl. I feel terribly for her. She just, like I said, experienced the flu, and that really knocked her for a loop. And here she now has COVID. And just very curious, we want her, of course, to feel better and get better. But at the same time, this is our first employee who hasn't recovered in what the normal 2 to 3 week period.
Mm-hmm.
So,
and recognizing how devastating that is financially
yes.
and personally. And has she expressed any real challenges about, geez, if I'm not there, somebody else has to be?
Actually, no, because she's actually one of our per diem employees. She typically just works weekends for us. But just more of a frustration of wanting to get back to work and wanting to feel better. And, we kind of thought we were on the right track with the sinus infection, hoping the Z-Pak would make her, relieve her symptoms in a few days. And that wasn't the case. So now it's kind of like back to square one, check in with your doctor again, see what the next step is.
Good. Yep, and that touching base, again, not from this, you have to get the data, absolutely, but just that personal touch of, hey, how are you?
Yes,
and we miss you.
We have heard some good feedback that those phone calls are important, that, they appreciate the checking in.
Yeah, good. Who's making those phone calls?
Our director of nursing, I'm usually in on them, and also our director of rehab as well.
Good. Yep. So when it's a rehab staff, you'll have your director of rehab.
We have her in the loop. Yep.
Good. So having that the leadership team value every member of our staff, so important in this time. Good. I see Kristen Gregory put down an interesting comment here. Anxious, stressful, and boredom when asymptomatic, but having to be quarantined because of an asymptomatic positive. Kristen, can you unmute and share some of that with us?
Yeah, so I actually tested positive back in July, and I was asymptomatic. So just being around my family, so when I get tested positive, I was around my sister who is in her 3rd trimester being pregnant, and now anxious about that, and being stressed out that, like, did I infect all my family? I was at home with both my parents, so just being around them, it was just anxious and being stressed, like, who did I affect being at work, being at home, in the community at that time, and being asymptomatic, not even knowing I had the disease or the virus was stressful.
Absolutely. Oh, sure. Were there folks that in your facility that reached out to you that helped you with that?
Yeah, I did have some coworkers that reached out during that time. I was only out for the 10 days, but I did have some check-in. I had a call every day to check in, and then I had some other of my staff members that called and checked in on me and texted me.
Good. You said only 10 days. 10 days can be a long time when you're used to doing things, right?
Yes, and considering I go to the gym about 7 days a week, so not being able to do that, it was a little hard.
Absolutely. Oh my goodness.
Dr. Bellatoni, it's Erin. I just wanted to let you know that we do have that receptionist that I had mentioned from Schuylkill Center that really struggled through her COVID infection and then ended up on a ventilator, but now is back to work for us. So she is on, and I think she's on through Kimberly Kimmel, who is the director of nursing. So whenever you're ready to hear her story, she'd would love to share it.
Go for it.
Hi, I'm Leslie Wagner, and I'm one of that 5% that ends up in the intensive care unit and hospitalized. Like within 2 or 3 days of the director of nursing telling me I tested positive, I was on a ventilator. I mean, it happened so fast. And I hear people that are saying, well, they had a sore throat or a sinus infection or an earache or something. And I don't think everybody realizes how bad it can get. I mean, well, obviously we have 400,000 deaths in the country, but yeah, I was very close to death, and my family was in fact told that I would not make it. But they called me the miracle girl at the hospital, and it was a long recovery too. as you would have if you're bedfast for 4 weeks. You know, I had to do the whole walking thing, and I still use a cane for balance, but there's some long-term effects too. Like people were saying about the fatigue and the brain fog. One they don't talk about is hair loss. Half my hair has fallen out. I mean, it comes out in handfuls every day. It makes me cry. I avoid mirrors whenever I can. But I mean, it doesn't sound, it sounds minor, but it's terrible. And I'm still tired a lot, and it's hard. Some days it's really hard. Other days not so much, but there are some residual things that are out there that you don't think about or know about, that they don't talk about too much. So anything you can do to support those folks that are testing positive is a good thing. It really is. And I got wonderful support from here. I even had an executive vice president calling me from Genesis. What's his name? Paul somebody. Paul Bach. When he wrote me a letter and emails, and I thought, wow, am I that sick? Am I the only Genesis employee that's that sick, or is he doing this with everybody? I mean, he really followed up with phone calls and emails and a letter, and those things meant a lot to me. I was worried because I just had found a job that I liked here, and I was afraid. I'd only been here for a few weeks, and I was afraid that I would lose that and have to start job hunting again. But I was lucky enough that they kept it for me, and I was glad to get back. And I could come back early because I don't have to walk the floors. I'm in the reception area, so it's a restricted area. My chair has wheels, which is good. And and they made accommodations for me, which was very much appreciated and very helpful.
Great. In your role as a receptionist, are you speaking with families? Do you take calls from families?
Oh, all the time. All the time. And I've had a lot of employees coming to me during this time of the vaccines, wondering, you know, what they should do. And a couple of them had said, when I think about not getting it, I think of you. And I go down there and I got it. I think of what could happen. Yeah.
You're such a role model for your entire facility.
Well, that's good to hear.
Yeah. And for all of Pennsylvania Genesis who are on the call today. So
Great.
I'll take a moment. I don't know if you can see us all, but I want to see some clapping and some,
Thank you.
so well done. And I bet when you talk to a family member, you can reassure them that you understand COVID.
Yes, absolutely. And I do it every day. Every day I'm talking to either the resident coming in or the family that's calling, and hopefully it helps them.
Good for you. Absolutely. Any other strategies you found helped you and your family during this time of COVID recovery that you wanted to share with us?
I think just the awareness that there are ongoing things. I'm glad people are talking about those long haulers. I know you didn't like that term,
Yeah.
but actually I sort of like it. You know, I do feel like a long hauler at this point.
Okay.
And just to be aware that there is stuff going on, and they say it could be for years. It could be permanent. Some of the effects we just don't know yet. So I'm just waiting for the next shoe to drop. No.
Yeah. But that I can tell you, I had to touch base with a physical rehab specialist here at Hopkins who's beginning to study this, and his best advice is use your energies, just as you are. And thank you, Adam, for saying beautiful energy, positivity, and that's it. Use it and continue each day to get a little stronger. So that's
Thank you. I will do that. Thanks for letting me share.
Thank you. Good. Let's see. Let me hear from others on what type of workplace accommodations, creativity within your own facilities to help your COVID recovering staff, or how you're doing staffing because staff must be out for 10 days when positive. And then also we're beginning to see the uncommon but real fevers that require someone to be out after vaccine, particularly second vaccine, for a day, sometimes two. What strategies are you using for those? Sometimes we're stuck with our not having a strategy when it's a short notice. And we particularly have challenges when it comes down to our vaccine distribution, because we don't have the luxury of multiple dates at this time, and so we here have a backups. We try to have backup schedules so that individuals are able to be covered when they need to be out. Okay. All right. I know that Erin and Adam, you're on the call. Anything from a corporate level that you wanted to share with us?
Well, I don't like to call myself corporate, but
Oh, okay.
I'm just kidding. So we don't have that much data on the second round because we're only at 30%.
Mm-hmm.
So that have completed that second round. So we have a lot of data. We're going to know, we're getting data rolling in to know how much that's going to affect everybody, as far as call-ins and things. But we struggle with staffing in our industry regardless. So, this really hit us hard. The quarantining, some states are more strict on the quarantining of staff who are exposed to positive folks, like at home or even at work. We've had that discussion because recently the CDC changed some of their guidance in December on that exact thing, exposure of staff to positive. So that's affected some of our states as well. They're asking to quarantine for 10 or 14 days, depending on the state. So that's challenging as well. So we struggle with staffing, and this time we're struggling with recruiting and retention. And our turnover rates, aren't, of course, they're not going in the right direction right now either. So it's a challenge, and it's really putting a lot of stress on the center leaders and the management teams there because they're the ones filling the shifts. Usually when there's no nurse or CNA, that's by default, and we struggle with that anyway. So it's a real challenge, and it's a lot of fatigue for them as well. And we probably don't talk about them enough. We talk about our frontline staff, but we probably don't talk about them enough either. So there's just there's just no pressure relief valve right now. An agency, some agencies are struggling as well to get staff to go into centers, depending on the community spread rate and those things, because they're probably fearful as well. So it's a tough environment right now.
Joanna Applegate, you shared that employee continues to have fatigue symptoms, and you're all supporting with teamwork. Tell us about that approach.
Well, she has good days and bad days. It sounds like everyone's kind of echoing that. When she's tired, it seems like other staff, I'm not in her department, but I've witnessed, other CNA, she's a CNA.
Mm-hmm.
She might sit down and other staff might help her with some of the things on her assignment so she can take her time, catch her breath. She's a wonderful aide, top of the line, high performer. So even when she has her good days, you can see her performing well. And when she has her bad days, she's not doing well. But it seems very clear that she's struggling the effects.
Mm-hmm.
And so when we can, we support.
Yeah. That's what our industry's called us to do. So thank you for sharing that. But Diana Ramos, you put in wanted me to be aware that as you're working with vaccinating staff, that there are individuals who remain not convinced that vaccine is what they should do, and asked how we support them. And it's an ongoing discussion. At this time, vaccination is voluntary, and I think most here are leading by example. I will share with you my own outpatient practice of geriatric medicine, where we have some staff who have not yet been vaccinated. We're all into our second round. It said 12:30 today is my second one, and they did not yet receive their first. And our approach has been to say we're available to do one-on-one chatting if you want to talk about your specific reasons that worry you, but leading by example, being very, very vocal and sharing that, in fact, we have been vaccinated because, in fact, we feel it is the safe thing for us personally and safer for my patients that I see every day, and I am seeing patients every day, and for my family. And then finding out what are the barriers. We certainly have heard some misinformation, and then we've heard some folks who say, but but might not get sick from the vaccine. And my response is, there is a small percentage that will get a low-grade fever and have muscle ache, but we understand that's not infection. It won't progress to pneumonia. And I brought with me some acetaminophen today, so that's what I plan to do, and move on. But I think there's research that shows there can be cultural barriers, and that's true of a good bit of healthcare. There've also been a good bit of health disparities, and one of the biggest, if I look at my number of emails today from Johns Hopkins Medicine, I will tell you the biggest issue about vaccine is everyone feeling comfortable. The vaccine has been offered to everyone equally, and particularly those who don't have electronic access. And because vaccine was available and no one wanted to waste vaccine, the quickest way to get it to our 75 and older patient population for Johns Hopkins Medicine was to have on our MyChart, our electronic access appointments ready to go. And so the first folks here on Monday that were over age 75 were the folks who were most electronically savvy or had family members who were electronically savvy for them. And is that causing a disparity in access to vaccine? And so there's a lot of effort right now with volunteers. Lists were already distributed yesterday of all 75 and older patients with their phone numbers and with specific staff charged with calling them to say, you are eligible for a vaccine through Johns Hopkins Medicine, and based on your zip code, this is the closest place to go. May I assist you in scheduling you? That's a whole lot of effort. That's also a very expensive effort, but to break down disparities in healthcare. But it is true, the first folks, Monday and Tuesday here, were the most electronically savvy. So Diana, I think I know I can see you there. I don't know if you can unmic and want to share anything more about that, but I think leading by example, and I see that on the national television where we have all range of leaders, everyone from the entertainment industry to public officials, to healthcare workers. I can tell you that seeing Dr. Fauci get his shot made a lot of healthcare workers, because they value what he's done over the years and known him for his great work in HIV. But sorry, Diana, you can't unmute, but thank you for bringing this to our attention through the chat box so that we can, because you're not alone in this area. Anyone else want to share their experience as we're bringing healthcare workers back? And I think through what we've just heard. Diana also shared a website that's Black Doctors Consortium, and I think I can copy that and see if I can put that into the chat box for everybody. Let me do that real quickly so everybody has, and I can just change this to everyone and send that on to everybody. So thank you, Diana, for sharing electronically a resource that may help some who are considering vaccine, but still challenged to make that decision, find the information that will make them most comfortable with their decision. And when I showed the data for CVS and Walgreens, a lot of discussion happening this week about those repetitive vaccines. Will they be distributed through our long-term care pharmacies? Will they continue, Walgreens and CVS, to schedule additional sessions for us? Because we will have our new residents, our new employees, and the opportunity for employees who were not vaccinated with the first wave to do so with ongoing vaccine dates. So this is all being rolled out, and so there will be more opportunity for those who took the wait and see approach to vaccine initially, but it will continue, just as those 7 topics that I showed in the survey of nursing home residents: communication, flexibility, leadership is what I would offer. Who else would like to share their experience with COVID recovering staff? Did we get everybody? Let me see. I think we've touched everything, but David, I do want, you mentioned grateful and humbled. David, are you able to unmute and share that perspective?
Yeah, some people were just so angry that they got the COVID, and then as they got sick, and I call them every day, just to check up on them, see how they're doing, if they need anything. They begin to realize how lucky they are to not be that 5%, and they're very, very grateful and very humbled about it. And when they come back, they're very supportive and sharing of their experiences with everybody.
You did raise something new, angry that I have COVID, and I would imagine those who particularly felt that the COVID was a work-related infection. How do you manage that anger?
Well, when I call them, I just talk to them, listen to them, you know, and we would chat, and then it was a great bonding experience for me too. I'm relatively new in this position, so when I'm calling these people that I don't really know, besides saying hello and whatnot, and you find out all these little facts, and I'd write them down, and the next day I'd bring it back up. They discover online shopping. Somebody that never went on the computer, so they discovered online shopping. Cleaning closets out, sending their husband to the junkyard, and this and that. And there's just those little ties that touched, that made it worthwhile.
It's finding that silver lining. Yeah.
So
great. That's great.
Yeah.
Mm-hmm. Thank you for sharing that, because we hadn't addressed, even in my Tuesday session, nobody brought up the word anger, but it's a human emotion, and certainly. Damn it, here I am helping everybody else, and what happens to me? Yeah, that's a human reaction that human touch makes a difference.
Yeah, you're welcome.
Thanks. Okay. All right, let me, anyone else before I share my screen again? I want to make sure everybody has an opportunity to share with us. Okay, let me go back to share my screen again. Actually, let me go back here. Yeah, so let's, actually, what I do want to go is to go back to that first slide. So let me, sorry, let me end this and then scroll up here a bit and go there. So next we're at IHI quality perspective, and so I'm going to actually ask unmute or stop sharing for a moment and ask Dr. Victor Boguslavsky if he would unmute and share the IHI perspective and quality improvement with respect to helping strategies for COVID recovering staff and staffing during this time.
Thank you, Michelle, and thank you, everybody. Wonderful, first of all, wonderful discussion about ideas. I have captured them a lot for sharing with the IHI's community at large, so that's very helpful. But also, excuse me, as we move forward into the next week, in particular in this session, I wanted to get your attention maybe to those key improvement questions, as we move along in terms of the putting things into the perspective of the improvement. There are some guiding questions that that many of you probably know, but just to remind you that helps you to think about what is working and what is not really working in your processes that you think require improvement, whether it relates to the specific session today or to the vaccination, and how would you define your success? How would you find your aim? And and what is the measure that you can sort of say where you're making the change that leads to the improvement, or it's just the change? And then how do you plan to implement your sort of next steps about getting to the improvement ideas? And those are the key sort of guiding questions that I think help you to think about how to think about this specific process of bringing the staff back to work, and also maybe also to look from the higher level process flow charts, as we spoke last week about those 4 key boxes, and how do you unpack that's a particular process. So I'll put those questions for you in the chat for you to think about, but also maybe we can have a follow-up kind of discussion when we start the next session about the particular changes that you think would be, or processes that you think would require improvement, and how did you manage those in order to put this into the perspective. This is just an ongoing process, as we will be more working into the next sessions, but I thought I wanted to share this with you. There is also a slide deck for this specific session, QI content, which is in the library. And if you are not there, maybe I will send this to you, Michelle. Is that okay? And then we can share with the team.
Yes.
That's again the same kinds of concept of thinking, but I think it's really important for us to start getting into the implementation, from the perspective of the quality improvement. Okay.
Great. And I've just updated my slideshow for the next session. Let me start sharing my screen again. So these are the questions that you've put in the chat box. Our planned use study act that we've talked about in prior sessions, and talking about our huddles to get to that root cause, what's working, what's not working, what is our goal, and we talked about being able to state our goal in just a few words, like the 3 to 5 words, just like what we started our session with, 5 words or less on COVID recovery, and then testing our hypotheses. So thank you. So I've added that to our 2 o'clock session for this afternoon.
Perfect, thank you.
And I wanted to wrap up our session for today with planning for next week. So next week's topic is the interdisciplinary approach to COVID-19 infection prevention and then care of COVID recovering residents that we serve, both short stay and long stay. So I'm hoping next week we might have more folks that have more than one individual sitting in front of the camera or sitting in front of the session that are from different disciplines and talking about how they work together. Here I run a vent unit, a chronic vent unit, and we do our weekly sessions together to share our perspective in caring for our COVID recovered patients. And particularly very important is our dialogue between our physical rehab team, our nutritionist, our social worker who's doing the social support, our recreational therapist who's addressing the brain fog that our patients have, even our speech therapist having to deal with swallowing disorders after being on ventilator, and how individuals are recovering their nutrition because they still have swallowing disorders. So I'd love to see multiple disciplines in front of the camera, appropriately socially distanced, and that we can talk about this interdisciplinary approach, something that we in long-term care have been heralding to a far greater extent and far more successfully than hospital care. So let's share our wisdom in that regard for next week. Okay. So with that, I'm going to stop sharing my screen and ask if there are any last comments. Erin, in your role, anything more you'd like to say?
No, I think this was a really, really great call and some really good discussion on our staff stories. And I think it resonated really well. I know it resonated with me, so.
Oh, yes. And I wanted to end by Ms. Pilkos. I'm looking up here to find your first name. Oh goodness, where is it? You mentioned blessed and grateful. I'm going to tell you that I am extremely personally grateful to each one of you on this call from Pennsylvania. My godfather, my uncle, in his 89 years old, is COVID recovering in a skilled nursing facility in Pennsylvania. I won't tell you his last name. It's not Bellantoni. Doesn't matter which facility. I'm just telling you how grateful I am that you're all there and working and helping him get back home. So thank you. So I am blessed and grateful to have all of you. Looking forward to see you next week as we talk about our team. Okay. And with that, bye now.
Thank you.